Today I'm going to show you how to build a Class 2 Division 2 case in real time. This one is a severe Class 2 Division 2 with an accentuated curve of speed. I'm Dr. Petra van der Merwe, an orthodontist with 30 years of private practice experience. I help dentists avoid common aligner mistakes and design predictable treatment plans for their patients. By aligning the teeth, I end up with collisions. So difficult, 0.8. Let's see. Good, but I've got those spaces to fill it in. There we go. 3-1. I can move it. There we go. 0.3. Let me just check. I don't like this position here. Okay, it's in position. And I sit with that space there. Okay, we don't want to go with that. Where's the most likelihood for a dark triangle? And I feel it's that area there, so let's close it up there. Come on. Don't like this one either. Actually going to make it 0.2. It's your worst nightmare if a patient starts complaining about dark triangles and your work is done, aligners are used up, and you have to pay out of your pocket some money for aligners to close that up. So we have to close that. And that's much better. This may force me to that's not helping at all. I had no collisions. Let's go back to that place. That is enough to prevent that tooth from moving there. We don't want that. So I want that tooth. The 3231 is my problem at the moment on which I'm focusing. The collision happens at the reel at the end. But if I move that one up, that is where the collision happens. There I've got room. And I've got rid of the collision. Now I can go. And I'm into the final positions from the front, and I've got a point through. I'm going to make this 0.3. And that less. There's a deviation in that profile there, so those teeth aren't, there's something going on there. That's where the tooth was rotated. I think we can sculpt that tooth there. Brush strength. Just remove that. And check it now from the top. Still got a abnormality there in the shape. I don't think that is the way the tooth actually looks. Very hard to tell. I don't have the original STL files to have a look at the tooth, but not good. This tooth is a rounded surface, this one is straight, so I can't imagine that it's really like that. Maybe I've taken away too much. But Still, I think we can approximate those two, and I'm creating myself a lot of trouble here. And even contacts. Okay, so there we've got it. No movement in the top as the dentist requested, and in the bottom, we didn't totally level the curve of speed, but we made good progress on that. We've got huge, heavy contacts on the canines due to the posterior interproximal stripping. They will have to be recontoured. All these other teeth will have to be recontoured, and we lost contact on these front teeth. So they're definitely not going to be stable. They're going to want to over-erupt till they touch again there. So retention in a vertical direction for these teeth are quite important. Okay, let's just quickly do the attachments. I hope it's quick. So I look at each tooth's movement. Let's start from the occlusal view, and I do an overlay, not contact, overlay, and the molars haven't moved, but I always like to add a retention attachment, especially if I look at the crown. There's not a lot of undercuts that will make the aligner stick there. So I'm going to grab an attachment. I'm going to use a horizontal one and just add something there and change it. It's easier if the profile is like this for the patient to insert it. It hooks in underneath, but when they take it out, it sometimes can be sticky there. So maybe change it slightly like that, then it slips off, and I would also decrease the height of it. Then it's an easy slip in and come off. I know some technicians would love to change it around, more something like that. Easy to slip over there, and now you've got, when you want to take it off, it comes off easily. I prefer it this way around, slip in easily, but it hooks, and I will just change the profile, make it less of an undercut. But if the patient gets his nail in underneath and just lift it off, it's supposed to come off easily. 0.1. And let's just copy, and for retention, same on that side. Make the profile slightly less. 0.01, there we go. It's slightly in the bite, so let's just remove all of that. Touching the bite there. Some patients are very sensitive for any contact on an attachment, so let's just get that out of the way. Good. Let's check more movement. These premolars just moved mesiodistally. Let's just check this for it. Sorry, a 0.5 millimeter of distal movement. Okay, let's take that off, and I'm gonna not for a 0.5 millimeter. I'm not gonna add anything additional. The grip aligners push, wires, fixed braces pull. So we'll have to check and see how much surface is available. What 0.5 of a millimeter, that's really a tiny amount. So the push on this surface, the mesial edge of this premolar there, very little push there, but still push there would be sufficient to move it a 0.5 millimeter for both the premolars, so I won't do much more there. Canines, distalized, the same. Let's just remove that and see. I've got a lot of surface there for the aligner to grip on, if it's made of a good quality and the suction or the pressure down is good enough. Not that much there. You can see there's more push surface there. The direction of movement of the 4-3 is purely distal. It pushes actually on that side there, which there is grip. I would still live with that. We can see when we go. We're going to need attachments anyway on the canines for the intrusion of the front teeth. So let's just see. If you intrude, you need proper contact. From aligner number 9, intrusion happens. And it's not only intrusion, we have to check the angle of the, there we've got a collision. So in a case like this, I'm not going to do tiny little movements to move this teeth around. I don't know if the dentist is going to accept it. When it comes back and they approve it, then we can just maybe do minor changes there. Now the point is, it's important for them to know where you're going to have attachments, that they can approve that. And we have to look at the intrusion. From aligner 9 on, intrusion happens. A lot of intrusion, and you can see on this table here on the left-hand side, the right-hand side of the screen, my left-hand side, 3 teeth at one stage intruding. 3, 2, 3, 1, there comes the 4, 1 and the 4, 2 added as well, and all of them goes in simultaneously. So that's a lot of intrusion. Normally I would then distribute the movement over a longer, more aligners, but that creates more of a collision there. So I'm going to remove that one, but I'm going to extend that one. There's not additional collision there. Let's see if I do this. Doesn't minimize that, but it gives me the intrusion forces spread over a longer period of less teeth at, not really, it's still 3. So let's just, for simplification for the dentist, at aligner number 9, we have to add attachments for this intrusion to happen. So 4 teeth at the same time intruding, so I would like to have proper anchorage for that. So I'm going to select again a horizontal one, tailor it quickly. I can actually just delete that one, use this one. Sorry guys, get that one, copy and add it to my canine. So the intrusion forces is going to extrude the canine. So the direction of force is going to be upward there, so I like the flat surface. When I do the attachments on the back teeth, I knew that there were hardly any movements and it's only mesiodistally. But in the front, I've also changed the long axis of the teeth. So let's remove the gums and go to the final position and then overlay, and then we will see, for instance, that crown came down but also moved to the mesial. So for that movement, I'm going to need an attachment. These very little, and in this one as well. So both the laterals had movements from the mesial to the distal. And I need to see when that has happened. Let's check out the 4-2. The intrusion was also the direction there. Let's check the 3-2. Just want to check that root. It's coming dangerously close to the canine there, so I can't really stop with it there. Going to have to change it slightly. Here we go. and that gives more space there. Okay, so let's go back at the root movement. And it's broken up in two parts. Okay, so the change in the long axis is not much. It's parallel, parallel, parallel. So this one is going to need an attachments for the axis change as well. So let's see, when does it happen? Not during that first part. Now when it starts intruding, it goes over there, which is a pity. Now I'm going to have to put an attachment on for the intrusion part. I would actually have loved it to happen during the first part of the movement, during that period there. On this one, the 4-2. There it only moves mediodistally and then it intrudes. For the time being, I'm going to leave it like that. I'll just make a note, side note for myself. So this one needs to be copied there. And then with this posterior grip anchorage, these 4 teeth are going to intrude. If you've got a lot of root surface and you're intruding at a very steep rate or at a high velocity, then you may have to add some more attachments. And I'd rather add more than less. I know the dentist will most probably ask me to remove some of it. I like to have enough anchorage. Vertical movements are some of the more difficult ones to happen. So let's just see, on the 4-4, I only wanted to start there, and the 4-3 as well, also there. The same period there, the 3-3 can go down to 9, and the 3-4 as well at 9. So now we can see that running through the plan, first only retention at the back to keep the aligner in place, and then as we go through the movements and we get to the intrusion phase, the 4 additional attachments are added to get the teeth to go down. And there we go. Thank you. I'm done with this treatment. No movement at the top as the dentist requested. Trying to keep the overbite, overjet the same for the patients, on the patient's behalf. I know, making it bigger, patients don't like that. It actually looks like it's bigger. So let's just check that there and see. My aim was to stay in the same trough, which I think I did. The blue is maybe slightly back there. So that may be a complaint. We'll see when it comes back from the dentist what happens there. And then, yeah, there we go. And then mainly the straightening out of the bottom teeth and the curve of speed that has been sorted out. So I'm going to save it and thank you. Goodbye.